So we'll move on to the next slide. If you look at the bottom of your screen, you'll be able to see a Q&A button. Is that up yet, Matt?
Yep, the Q&A button should be available to everyone who is on mobile and on desktop. And also just a check for everyone in the chat. Can you guys hear us okay? And do we sound clear?
That's a good question.
Fantastic. Thank you so much, everyone.
All right, so please take the opportunity to ask any questions that you have about the whole process. It wouldn't matter which year or if you're a parent, doesn't matter what year your child is as well. So just make sure that you put in your questions, and you can also upvote them. So anyone that sees a question that they want to be answered, you can upvote that and they'll come up to the top. That way we'll be able to address those earlier, depending on the popularity of that question. Okay, so to kick things off onto the main talk. So my name is Dr. Jason Yu. I'm a primary care physician and also allergy doctor. And also I'm a chief medical officer of Medinet, which is a medical software startup. And I also run my own clinic at My Health South Eveleigh near Redfern. So reason why I'm so involved in Mission Med is because I do have a passion for teaching. So I do also have medical students that come through to my clinic where I teach them and mentor them to become doctors. So that's the reason why I run Mission Med, because I do enjoy helping students fulfill their lifetime dreams. So hopefully you'll find this session informative, and I'll pass it on to Matt to introduce himself.
Hi, everyone. My name is Matt. I'm a med student at the moment at UCID. We all came together very early on because we thought that this was a really good initiative to help students figure out the confusing process that is the medical admissions process. So I'll hand off to Mukund as well to introduce himself.
Yeah, good evening, everyone. So my name is Mukund, and like Matt, I'm also a medical student at the University of Sydney. It's awesome to see so many of you guys here at, on a Sunday evening, ready to, get introduced to the world of medical school interviews. And it's awesome that you guys are all keen to start preparing early as well. And so hopefully by the end of this webinar, you'll understand, like a bit more about the process of preparing for your interviews, and also the importance of preparing with a really, really good foundation. Just letting everyone know as well, this webinar is going to be recorded. So you'll get a recording sent out afterwards. And I'd also like to introduce a special guest that we have along with us. Her name is Doris Wu. She's a fantastic medical student. She was actually one of our former Mission Med students a few years ago, and it's been awesome to see her grow. She started off doing interview preparation. She was in a webinar just like you guys are today. She, prepared with us, made it through her interviews, and now she's a medical student on the other side and is one of our fantastic interview tutors as well. So Doris, would you like to introduce yourself too?
Hi everyone, I'm Doris. So as Mukund said, I'm a 30 medical student right now. And 3 years ago, I was actually sitting in the same Zoom call in a very similar webinar. So it feels very full circle for me.
Awesome. Thank you so much, Doris. So let me tell you a little bit about what we're going to kind of discuss today. So first of all, you're going to learn about why the medical interview is significant in the entire process. Then we're going to talk about the different types of interviews and the common interview structures you're going to see across Australia. Then we're going to break down some question types to give you an idea of how an interviewer is going to mark your responses. Then we're going to talk about the biggest mistakes that students tend to make during the interview preparation process. So Jason will kind of walk you through all the things that he's seen over the past sort of 13 plus years that he's been teaching medical students or teaching students to get into medical school. We're going to get a bit of firsthand insight into what the entire journey sort of looks like from Doris. And maybe that way it'll help you kind of imagine how it could look like for you. And then finally, we'll give you a brief kind of introduction of what Mission Med and how Mission Med can help you. Okay, cool. So first of all, let's talk about why we do what we do. I just want to kind of briefly mention that. When I prepared for my medical interviews, I attended a lot of intensive workshops that spanned a number of different days, and they were generally good pieces of information, but they really lacked structure and depth. And often I was really unsure about how interviewers would perceive my response. And so it was very much a guessing game. And I think many of you probably feel that way too. And so given the environment and lack of personability, it's quite difficult to learn effectively. And so that's why the three of us initially started Mission Med 4 years ago. And Dr. Jason brought a lot of his interview panelist experience from what he's done in the past, as well as his mentorship in the past. So I wanted to give high school leavers applying for medical school a sort of structure to master their interviews. So that's kind of the reason why we started Mission Med in the first place. So with that in mind, let's go through to the significance of the actual medical interview. So I'll pass off to Mukund now, where he will go through this.
Yeah, thank you, Matt. Do you want to just hop onto the next slide for me? Yeah, perfect. So basically, I'm sure most of you guys in this call have a general idea of the three main components that are going to make up the application of an undergraduate medical school candidate. So you're going to have your ATAR and your UCAT, followed by your interview usually. The reality of the situation is that most students tend to overlook and underestimate the interview as a significant component of the selection criteria. And what I mean by that is you're obviously spending the entire year doing your HSC and studying for your ATAR, and you usually have a good 6 months at minimum to work on your UCAT too. But most people only really start looking into interviews after their HSC exams, and that can often end up being quite late and quite rushed. If you look on this slide as well, you see that the weighting for interviews varies significantly across universities too. So some universities, after you've received an offer, use it as the sole criteria of whether you get it or not. So essentially your ATAR and your UCAT may act as hurdles, but ultimately the only thing that actually matters whether you get the offer for medical school or not is your interview. And so if there's one take-home message that you're going to get from this talk, is that interviews are serious. Like, they're very, very important, and it's something that you should definitely prioritize along with your your HSC subjects. It's not something to kind of leave on the back burner. Another point that I want to raise is that even though some universities have different weightings for their criteria, such as like Monash, for example, like a third. Sometimes, depending on the criteria, a high ATAR and a UCAT score can't actually compensate for a poor interview. So some people think, oh, if I smash my UCAT, if I get a crazy 99th percentile score and I get a perfect ATAR, then I don't need to do as well in my interviews. Unfortunately, that's actually not true, because a lot of universities have hurdle scores for their interviews as well, and you need to be below the bottom 25%, for example, in order to actually get the offer. So universities can end up actually disqualifying you from being a candidate if you have a poor interview score. And UNSW is a very common, notorious example of that, where a lot of high achieving ATAR and UCAT students every year end up getting rejected because they think that because they have those two things, they don't need to try as hard in the interview. So ultimately, the crucial issue here is that the average student doesn't take the interview as seriously as they should, which is kind of crazy to think about, because you think if you have your interview offer, you're going to get one, you practice really, really hard. But unfortunately, that's not what we're always seeing. And Matt, if you go to the next slide for me. Yes, I just want to draw your attention again to this table that essentially summarizes the number of medical school spots offered each year across various universities in Australia. So obviously each university has different capacities, and so you can get capacities as high as over 200, like you get with Monash and UNSW. But if you look at the success rates Obviously, we don't have the data for everything, unfortunately, but based on what's available, the success rates, aren't super, super high. And so as a result, you can see that getting a medical school offer based on your interview is still very, very competitive, even if you are good enough to actually get an interview offer. So I think the national average is around about 30%. So each year, 30% of the people that get an interview offer actually get accepted into medical school. So it's very competitive, and we want to make sure that you guys actually start off on a very, very solid footing. So I'm gonna now just go over the two main interview formats. So Matt, if you'd like to go to the next slide. So to start off with, I just want to introduce you guys to the panel format of interview. Basically, what the panel format of interview is you're going to have 2 or 3 interviewers who interview you for the entire duration of the interview. So that could be, anywhere from like about 20 to 30 minutes, and they'll just ask you a bunch of questions. Usually it's fairly structured, so they're going to ask the same sets of questions to everyone on that day. And the panel actually can comprise of a mix of healthcare workers, academic staff, and even just people in the community. So you really don't know who you're talking to. You could be talking to a professor of medicine. You could be talking to literally just a random person who they asked to volunteer. And so the questions are generally independent of each other, but they can kind of build onto each other as if it's a discussion, but that depends on the university as well. And so panel interviews are notorious for being a bit time pressured. So for example, UNSW generally gives you an average of about 45 to 60 seconds per question. So it's just as important to be concise as it is to have an answer with good analysis and depth that shows who you are as a candidate to the interviewer. And that actually takes quite a lot of practice, as you can imagine. And so at the bottom of this slide, I've just put in a few example questions that have actually come up in the last couple of interview cycles at various panel universities, just to give you a taste of what to expect. Later on in this webinar, we're actually going to run an exercise with you guys just to break down, to get you guys to volunteer some answers or thoughts to some questions. I'll just talk you through the ones at the bottom for now. But if you look at the first question, how would you approach a friend engaged in unethical behavior? So I'll give you guys, just like a quick moment to, just break that question down in your heads and just think about it. And while you're doing that, I hope you can essentially appreciate that it is a very difficult question, because it essentially tests your ability to balance a friendship with ethical obligations. In fact, the worst possible answer would be to think that they just want you to say the right thing is that your friend, is like a terrible person. They did something wrong, so you're no longer friends with them. That's not what they want to hear. They want you to be able to balance the friendship component with the unethical behavior. And so commonly when we first start mentoring students, a response that we might get is along the lines of, are they just going to like no longer be friends with them or not? But the interviewer wants to see that you aren't a judgmental person. They want to see that you understand that it's unfair to judge someone else's behavior when you don't actually know what they're going through. So that nuance and discussion is very, very important, is actually what sets apart that 30% of people that end up getting medical school offers from the 70% that don't. And so if you look at the second question, how has the role of a doctor changed in the last 100 years? So this might be a bit more of a curveball question. Every year you're going to end up seeing a few questions that might just be a little bit unconventional, out of the box, something you don't fully expect, right? But I think ultimately having a way to approach those sorts of questions and thinking about what they're actually trying to assess you on is very, very important. So while this question is partly designed to, I guess, weed people out who might not be aware of where the field of medicine is now and some of the developments that have been made, it's also trying to get you to explain your understanding of the realities of medicine as a career now. So the question wants you to dissect the doctor-patient relationship, but is also inadvertently assessing your intentions for wanting to study medicine in the first place. So it's actually quite a tricky, nuanced question that is kind of posed very, very innocently. So I hope you guys can start to appreciate that. And now finally, I'm just going to talk about the MMI interview format. And so essentially the MMI interview format is where students move from station to station, answering different questions at each station with a different interviewer. Again, the interviewer could be just about anyone. You really don't know who they are. And this is a very common interview format at places like Western Sydney University, JMP, UQ, Monash. There's quite a few places that do this. And sometimes, especially since COVID, some universities have continued for this to be online, but some are slowly starting to move back in person too. Some of the stations could include personal questions where students are asked to, asked about themselves, their experiences, but a lot of the times the questions are more to do with scenarios, so ethical scenarios or problem-solving scenarios where you have to deal with some sort of dilemma or issue. Occasionally, and this was more common in person, but they're starting to introduce this online too, there may be some skills-based activities, such as dealing with an angry actor or solving some sort of puzzle and explaining your reasoning. They tend to be around 8 stations, or sorry, 8 minutes per station. And each interviewer, like I said, is going to be different. And as I already mentioned, they tend to, that recently they've been online, and we can expect that there might be fewer stations online than in person. So 8 minutes per station is not much time considering the depth a candidate needs to achieve an excellent answer, especially when you have 4 or 5 questions associated with the STEM that they've given you. So again, it's very, very important to balance the depth and concision required to be in that top 30% essentially. I guess the main advantage of the MMI is you can afford to, have a poor station because the interviewer doesn't actually, the next interviewer in the next room doesn't actually know you or know how you did. And so each question is essentially a new sort of judgment. And so if you feel like one question is particularly hard, that's okay. I don't know very many students, myself included, when I went through it, that was just, went through all 8 questions and thought it was perfect. Usually sometimes, it is a bit tricky, but that's one of the beauties of the MMI. You can get by as long as you're like overall fairly consistent. And so again, if you look at the example question, I'll read this out slowly, but feel free to read along and just have a think about it. So 12-year-old girl has lost a lot of blood after falling on a sharp rock that has pierced her leg and needs a blood transfusion to save her life. However, the parents are Jehovah's Witnesses and adamantly refuse a blood transfusion from their daughter on religious grounds. You are the consultant physician. Explain what you would do in this situation. So it's very interesting because, as a potential candidate for medical school, you read a scenario like this and you think, wow, like this is just a very, very weird, extreme example. Literally 3 weeks ago on my placement, I actually encountered a situation almost identical to this, where there was this young female who lost a lot of blood, and they were Jehovah's Witnesses, and they actually refused a transfusion. So you'd be surprised that a lot of these random scenarios that come up in your interviews might actually be things that you experience one day. And so in your actual MMI, you'll probably get this as a STEM outside the room door or right before you enter a breakout room for your panel or your MMI interview. And once you walk in, they'll ask you some sub questions or some specific questions associated to the STEM. But when you're thinking about a STEM like this, essentially, again, you don't want to ever jump into a discussion with one very specific direction. You want to make sure that you're able to synthesize multiple arguments or points of view. So some of the perspectives here include discussing the parents' religious beliefs and how they play into your decision making, as well as the young girl's deteriorating condition. So a solid answer, one that can actually get you into medical school, is something that kind of ties in the idea of religious sensitivity, the responsibilities ethically of a physician, hospital protocol, which is sometimes something that students don't really discuss, legal ramifications, as well as your own personal ethical and moral implications. And so I hope you guys can appreciate once again that a challenge here is for students to be able to think about that and answer within an 8-minute period. And that's something that requires lots of practice. Essentially, none of us expect you guys to be able to look at this question, at the very start of your journey and just rattle off all those things, right? But the more questions you do and the more feedback you receive, the easier and more second nature that becomes. Because on the day of your interview, when you see something a bit more novel, you can think back to some of the concepts that came about in your practice, in your mock interviews, when you go through our question banks and whatnot, and ultimately tie it all in to be a very, very stellar candidate in that top 30%. And so while the MMI and the panel are two different types of interview structures, the preparation for both of them actually overlap significantly. And it's very, very similar skills that need to be developed. And I guess something I just want to highlight real quick is that the skills that you develop during this journey, they're actually skills that last for the rest of your career, right? Because you're always going to have to be in situations where you're going to have to speak confidently and articulate your thoughts and form arguments once you're in medical school, once you're a doctor. So this is really the start of a very, very long journey. And that's something Doris is going to address later on as well. But I just wanted to bring that up now too. And so basically this final slide that I have for you guys just goes over the different interview types at different universities. As we know of so far, these can be subject to change, unfortunately, especially if some interviews last minute decide they want to do it online instead of in person. But in general, the actual formats, whether it's MMI or a panel, don't change very frequently. And so feel free to take a screenshot or a photo, but they're going to be, you'll get a recording anyway. And so now that we've kind of given you guys a very high level overview of what to expect with preparation, Matt is now going to go over some practice questions in a bit more detail, but they're going to be a bit more interactive because we really want to use this time to allow you guys to articulate your own thoughts and get some feedback as well, because that'll be a very, very good learning opportunity. So I'll hand it back over to Matt.
Thanks, Mukund. That was wonderful. And hopefully everyone managed to get a photo of that. So now we're going to go into a bit of a question breakdown. And we're going to do, in the interest of time, one panel question and then spend a bit of time on a MMI question. So the first panel question, this question here is actually from a panel interview from the 2022-2023 interview cycle. So 2023-2024 interview cycle, this was a real interview question. And so if you came across a question like this, which is, you've been given the power to solve one problem in this world, which one would you choose and how would you approach it? Does anyone want to give this a crack, or anyone brave enough to see if they can come up with an answer for this? Imagine if you were actually in the interview. And I think what you can do is you can request to speak, and we should be able to see you requesting. So if anyone wants to give it a go, there should be a button at the bottom of your Zoom meeting screen that says request to speak, and you can do that, and then we'll be able to prove it and let you talk. Fair enough. Very, very difficult. If you have things that you've thought of that could be good to say to this question, feel free to use the webinar chat instead to type in some things that you think might be good to talk about. And in the meantime, I will go through some of the things that you would expect an interviewer to actually look at when they're assessing how well someone is doing this question. So, okay, we've got someone saying, is stuff like world hunger too basic or not? So That's actually a good subject. Oh, okay, we've got a couple of people raising their hands. What is this? Let me, Les. Okay, cool. Attendees. Hi, Les. How you doing? Would you like to give it a crack? Oh, I don't know if we can hear you. Someone asks, would you want it to be medicine related or not? Okay, so the important part, maybe I should get into what someone would actually think about as an interviewer, right? So if an interviewer is assessing how well someone does in this question, the main things they're thinking about is A, does the chosen problem have significant global or societal importance? In other words, is it something that actually matters to a lot of people? But more importantly, does the candidate actually demonstrate a thorough understanding of the problem itself? So like beyond the surface level understanding, does the candidate actually understand the root cause of a lot of the problems they're bringing up? Thirdly, they want to see, is the proposed solution that the student is suggesting innovative, realistic, and practical, and actually has some detail in it, as opposed to being very abstract about their answer? Fourthly, has the candidate considered ethical implications of their solutions? What can potentially go wrong? For example, if you decide to, provide free access to water across the entire world with no payment, then does that cause any other downstream issues, right? That's something that they want to see people consider. Does the candidate recognize the need for collaboration with other parties aside from just themselves? And finally, will the proposed solution have lasting effects that prevent the problem from recurring? So what interviewers are interested in is less so about the problem that you bring up, but more so about how you're thinking through the actual problem and what aspects of the problem that you're considering when you come up with your solution, and talking them through it so they understand that your thought process is more complex and deep than something just, oh, this is a problem, here's a quick solution, right? And this sort of skill is important beyond medicine, but also just in problem solving more generally. So that's an example of a panel question. Pretty tough to answer in 2 or 3 minutes, but definitely one that you'll eventually get very good at with a bit of practice. So Michael says, I don't have a mic, but my idea is for opioid use, pain management, use some stats and expand more problem. Perfect. Yep. Opioid abuse is a huge problem. So definitely an issue. Sophie says maybe education inequality, because a lot of systemic issues stem from a lack of knowledge, medical or otherwise. Perfect. Great topic. And Michael says my approach would probably be some sort of stricter opioid regulation and more rigorous opioid rehabilitation. Also opioid trackers. That's good. So what Michael did really well there is he gave specific examples, and that's what sort of interviewers look for, are these specific examples and explaining why those examples are good. And LS says, would corruption work, or is that too abstract? It depends how you spin it again. I think you really have to give a problem that's well, sort of fleshed out, and then potential solutions that are also well fleshed out. Okay. Cool. So the next question we might go to is an example of a MMI question, which is what Mukund sort of talked about earlier, which is the stations. So for example, at an interview, you have 6 to 8 stations, and then there's a scenario at each station with a set of questions associated with those stations. And this is an example of the bit of text you might see outside the room before you walk into that station. So what that text says is, at the University of Sydney, you formed a close bond with a fellow student, Sam. And while you both share a passion for medicine, your friend often indulges in the vibrant local nightlife and enjoys drinking regularly. After a particularly wild weekend party in the CBD, he rings you on a Sunday morning and, distressed from a severe hangover, he admits his inability to work on an important assignment due the next day. He asks you if you would complete it on his behalf. So that is the scenario. And then when you walk into the room, imagine that the interviewer then says, "You've read the scenario. Now here is the first question. How would you respond to your friend's request?" So in this situation, right, you can take 30 seconds, 20 seconds, whatever it might be, to have a think, and then you have to start answering. So in this situation, is everyone brave enough to give this a go? It'd be a lot more interesting. Okay, great. Bridget, perfect. Give it a go. Oh, sorry.
Hello, can you
Yeah,
hear me?
hey Bridget. Yeah.
Okay. I would probably start by like acknowledging that yeah, I try to like explain to him that obviously he should have probably started on his assignment earlier. But of course you cannot like do work for other people because that's plagiarism. So yeah, I would probably just explore those, like, explaining to him that maybe he should contact his teacher or his university and explain the situation to them. Or try to work on it or ask for an extension for his assignment. But of course, you cannot complete work for other people. You could possibly help him or read through the questions for him and explain some of the help him study for it. But of course, you cannot do work for other people.
Fantastic. Well done, Bridget. And first of all, round of applause for Bridget for having the guts to go and say this and answer the question. Well done. So what I really liked about your response is that you brought up both sides of the equation, right? You said, look, I want to be able to help my fellow friend Sam, but I also recognize that, this issue is an ethical issue and it would be a plagiarism and a breach of ethical and moral, standpoint if I were to go and do this. And so this is a really nice balanced response. And so to kind of explain how an interviewer would assess your response, these are the sort of things they're sort of thinking about. First of all, does the student actually recognize that the academic integrity would be breached in this situation? That's sort of the major issue in this scenario, right? So if the student correctly identifies this, then that's a tick on that particular point on the marking criteria. And if a student doesn't correctly identify this, this would be on grounds for the student to fail this particular station, because that's a must kind of fulfill criteria in this station. The second point is, does the student actually consider the impact that the friend's request has on the actual relationship between yourself and your friend? And this is the balanced kind of approach that Mukund was talking about earlier. And recognizing and addressing that ethical tension between, someone being your friend, but also them suggesting that you do something that's unethical is important to not beat around the bush about and actually talk about. And so a high scoring answer would definitely navigate this and address this outright. The third thing that people often forget to address, but is important in the actual marking criteria as well, is considering Sam's well-being, right? So this is something that's important and shows that you're an empathetic person, and a high scoring answer would also consider this. And finally, something that Bridget did really well is bring up the possibility that she could support Sam in other ways. So rather than doing the work for him, right, she could potentially offer support and help and how to understand the content as opposed to actually doing the assignment. And so you can help Sam with his research, but still specify clearly during the actual interview that you wouldn't breach the actual academic integrity. So those things are what would be considered together a good answer for the interview and meet and tick off all the criteria necessary for this particular station. So to give you another example, let's say now, so if we're talking about the MMI interview, they typically come with 3 to 4 questions associated with a single scenario. So this would be the second follow-up question in that particular scenario. And this particular question says, during a clinical round, a patient seen by Sam complains to you that they could smell alcohol on his breath, how would you approach this situation, and what is your primary concern? So given that particular question, does someone want to have a look at that and think to themselves, how would I answer this? Aless, let's go with you.
Hello,
So-
can you hear me?
Yep, I can hear you. Perfect.
So yeah, sorry, my microphone wasn't working previously. I just
Good. All good. All good.
okay. So I think that if a patient reports smelling alcohol on Sam's breath during a clinical round, my primary concern firstly would be the safety and well-being of the patient. But however, it's really important to maintain a professional role and a safe environment for all patients in the hospital. So I think that my first step to address this situation would just to discreetly speak to Sam, maybe in like a private room or somewhere somewhere that's away from the patient, and speaking to them privately. In this like when I speak to him, I speak to them, pardon me, I'll express my concern for both the patient's comfort as well as Sam's well-being, mentioning very sensitively that a patient has reported smelling alcohol. And I would ask Sam if they have consumed any alcohol recently. And if they have, I would encourage them to step away from patient care if they are impaired in any way. If Sam does admit to having consumed alcohol, I would advise them to potentially leave the clinical area, and I would have to make a report and document the incident to a supervising doctor or any relevant authority to ensure that patient safety is maintained. That is my main priority. But however, I would also offer my support in helping Sam seek any assistance they may need, such as counselling or support, as well as just being a friend and just offering an ear for them to talk to, as I believe it's important to recognise our own well-beings. So yeah, ultimately my primary concern would be to ensure the safety and trust of patients whilst also supporting a colleague in addressing any professional challenges they may be facing. But simultaneously, I have to address the situation with sensitivity and be professional.
Fantastic. Well done, Aless. And, again, congrats on a beautiful response. What I would say I love about your response is two things. First of all, you gave a balanced response. You both addressed the ethical nature of it while also maintaining the relationship with Sam. The other thing I liked about it is you signposted very early on the things that you wanted to talk about. So you said very early on, you're concerned about X, Y, and Z, and then you broke that down for me in more detail. And that's exactly what an interviewer would be looking for, right? So to give you a bit of an idea, first of all, as you said, the most important thing in this scenario that an interviewer is looking for you to address is patient safety. So if you're at home right now and you're trying out these questions, and the first thing you didn't think of was patient safety, then this would be considered grounds to fail this particular station. Not trying to, scare anyone, but just saying, for the future reference, with more practice, these are things you'll eventually come to think of. So other considerations you might be thinking about are obviously Sam's career, the university's reputation, the hospital's image if a harm was to come about to the patient. Those are things that you may also choose to consider as separate issues outside of the patient health. And you also want to consider whether your friend is under the influence regularly during clinical rounds, and consider that it's maybe not optimal to start off with an accusatory agenda, right? So interviewers want to see that you, first of all, address your friend in a private situation or a private environment such that it doesn't put them in an uncomfortable position. And you may try to explore with open-ended questions rather than going like, are you drinking? Why are you drinking? Etc. The third thing they want to see is that you escalate the situation when necessary. So for example, obviously it's not optimal to go behind your friend's back and report him, and it could ruin your relationship. But also, aside from that, you want to first address specifically with Sam himself. And then if that does not go well, then unfortunately you do have to escalate beyond the local sort of situation. So you want to carefully navigate how you would do this whilst still remaining empathetic and supportive to Sam. And one of the things you could consider is asking or encouraging Sam to report himself. And then if he doesn't do this, you could raise this issue with the supervisor. And so finally, of course, supporting Sam is the other important issue to address. There may be more important or insidious reasons as to why Sam is actually drinking, and perhaps you could offer help in that sort of faculty as well. Great, fantastic. So that's a good walk through that particular question. The last question in this station that we're going to go through is Sam admits he has a drinking problem when you confront him. However, when you suggest counseling, he says he hates it. How might you persuade Sam to seek help? Once again, tough question. And imagine you've got 2 minutes left in your station. Things are racing through your head. How you answer this question? Okay. Before I chuck it to Bridget, I want to see if anyone else wants to give it a shot. Otherwise, we might throw it back to Bridget. Okay, cool. Bridget, take it away. Oh, sorry. I don't think we can hear you at the moment. It's all right if
Sorry, hello. Sorry.
Yep, hello, yep,
Okay.
cool.
So I think when addressing this question, our primary concern as Sam's friend is his well-being. While also, the fact that he had been drinking or had alcohol in his breath from the past question during clinical rounds. So, his career as well. But the fact that he doesn't want to go to counseling, I think that the first thing to do would be to sit down with him and explain how counseling can help, and how, and ask why he hates counseling and try to address that issue and explain to him that, counseling can very much help. And yeah, ask why, where does this drinking problem stem from? Basically, you just want to be there you want to he's as his friend, you want to ensure that his well-being is looked after. So of course, understanding the underlying issues that are affecting this drinking problem, and of course trying to understand why he's not seeking counseling.
Well done, Bridget. What I loved about your answer is that you asked open-ended questions and tried to figure out more about why Sam didn't want to do counseling and potentially address some of those things. So let's kind of go through how an interviewer might have assessed this response, right? So first of all, what they want to see is that you actively address what Sam has told you and let him know that you appreciate that he admits that he has a problem. And when you do this, obviously, it shows your empathy, as it's often difficult for people to admit their mistakes or that they have a problem. And so letting Sam know that he's not alone in the struggle is something that's really good to start off with. Then they want to see that you're empathetic and support your friend, right? And so that's obviously a given. The third thing they want to see is that you ask open-ended questions, which Bridget did really well. You ask about why he has fears or reservations and understand perhaps some of the things as to potentially what could have happened in the past that may be causing that why he doesn't want to go. And you could pose even examples of reasons. For example, maybe he had a bad experience as in childhood with a counselor that didn't treat him very well. Then you want to say how you would challenge those misconceptions about counseling. So not only do you find what the sources of the objections might be, but also explain to the interviewer how you might tackle some of those objections. So if your friend has some beliefs about counseling that you don't agree with, challenge them, but don't pressure them, right? They're different. And this may prompt a healthy and more productive discussion about what counseling actually is and how it can help them. And finally, this whole process we acknowledge is something that is difficult. And so if you don't have all the skill sets needed to help Sam, you can also reach out for help and ask for potentially friends, with Sam's obviously approval, to help out with the situation too. So ultimately, tough question, but again, with enough reps, you'll know what sort of things are important to touch on and what sort of things the marking criteria in these interviews are looking for. So well done, everyone. And thank you especially to the people who were brave enough to raise their hand and actually have a go at this question. The next thing that we're going to go through in this webinar is around the biggest mistakes that Jason has seen students make over the years in terms of interview preparation. So I'm going to hand over to Jason now.
All right, thanks, Matt. Let's try to get through the next part quickly because I know that it's already been quite a bit of time. Okay. Matt, can you play? I believe there's a video on the next slide.
Yep. Okay. What do you want me to play? Which part?
So let me just introduce that video. So that video, short video, is from a well-renowned surgeon. His name is Dr. Atul Gawande on coaching. So he did a TED talk on coaching, and I found it really, really inspiring. And also it made me really think about how I could apply that to my own personal life, even as a doctor now. So if you've already seen it, I apologize if it bores you, but let's just take 2 minutes to quickly watch it. So Matt, if you can play that video for everyone.
Let me just make sure people can actually hear it.
You should be embedded into the slides, so.
I think you have to unmute yourself, maybe, Matt.
Yeah, Matt, you're still muted.
The greatest in the world needs a coach. So I tried to think about this as a surgeon. Pay someone to come into my operating room, observe me, and critique me. It seems absurd.
Yeah.
Expertise means not needing to be coached. So then which view is right? Turns out there are numerous problems in making it on your own. You don't recognize the issues that are standing in your way, or if you do, you don't necessarily know how to fix them. And the result is that somewhere along the way, you stop improving. And I thought about that, and I realized that was exactly what had happened to me as a surgeon. So I asked a former professor of mine who had retired, his name is Bob Osteen, and he agreed to come to my operating room and observe me. The case, I remember that first case, it went beautifully. I didn't think there would be anything much he'd have to say when we were done. Instead, he had a whole page of dense with notes. Just small things, he said. Did you notice that the light had swung out of the wound during the case? Another thing I noticed, he said, your elbow goes up in the air every once in a while. That means you're not in full control. It was a whole nother level of awareness. He was describing what great coaches do. And what they do is they are your external eyes and ears, providing a more accurate picture of your reality. They're recognizing the fundamentals. They're breaking your actions down and then helping you build them back up again. After 2 months of coaching, I felt myself getting better again. And after a year, I saw my complications drop down even further. It was painful. I didn't like being observed. And at times I didn't want to have to work on things. I also felt there were periods where I would get worse before I got better. But it made me realize that the coaches were onto something profoundly important. I think it's not just how good you are now, I think it's how good you're gonna be that really matters.
All right. All right, thanks for taking time out to watch that video. So hopefully, the next point I'm trying to discuss is one of the biggest mistakes I see is students not getting feedback for their responses, for their answers, or when they practice. So in the past, for me personally, I always try to be the person who would try to do things solo. And it doesn't always work out. And also when you try to do things as a solo person, you spend a lot of time trying to, making those mistakes, trying to figure out yourself. Okay. So you end up wasting a lot of that time. So I found as I got older that, time is very limited. It's a very limited resource. So what I'm trying to tell you is that if you can find a mentor, find out someone that can guide you, and give you feedback on your responses, you'll improve a lot quicker, a lot faster than if you were trying to do it yourself. Okay. So a mentor is someone who can make the whole process of learning a lot easier for you, than if you were to fumble around on your own. Okay. So finding the right mentor is so important. And receiving the right feedback from them is going to make or break your performance in the medical interviews. So I just want to make that point clear. And I think that's the biggest mistake that students kind of fall into, is that they try to do practice by themselves, and it just doesn't work out well for them, because you just don't notice all these mistakes that you're making without someone else to actually actively tell you. Okay, so I've tried to implement that into practice for myself as well. I also shadow a lot of other specialists to learn more about how I can also become a better doctor and actually practice better medicine. So you're never truly finished in your learning. You can always do better. And I think finding a coach or a mentor is going to be immensely beneficial for you. Okay, so now we'll move on to the next mistake that I see very often, is not preparing early enough. Okay, so what I mean by this is the skills that are expected in the interviews, they're not covered by the school curriculum. So a lot of students don't build up these skills in the 12 years that you have leading up to your HSC. So communication skills also take a lot of time to be mastered. And I'll show you another video a bit later to kind of describe why this is so important. So I've also noticed that the students who have done debating or public speaking, they're the students that actually tend to outperform most other students, because they've honed these skills over many, many years. And they just have to tweak the answers a little bit to fit the recommendations that we give to students. And they usually end up doing very, very well, because they already have these kind of abilities already practiced over such a long period of time. So if you don't have that experience and you don't have those skills already developed, now it's a really, really good time to start developing out those skills, because as Mukund mentioned earlier, you're going to be using these skills for the rest of your life. Recently, I just caught up with another friend who just sat 9 interviews to get her job as a trainee specialist, and she ended up doing rheumatology, but she had to sit 9 interviews. So all these skills that you build up during the course is going to be applicable to that as well. Okay. And also, if you don't prepare early enough, you also don't understand what each university is looking for. So not understanding the criteria that each university is marking you on, because some universities, it's very time pressured. You only have 1 minute to answer a question. So you really need to be kind of understanding which university you're applying for, how they're going to ask you those questions, and what's expected of those universities. All right, so now we'll move on to the next pitfall, which is an academic focus. So a lot of students, again, you kind of spend 12 years just working really hard to your HSC, working really hard on your UCAT, because you had a lot of time to prepare for some students. But at the end of the day, the interview is not about assessing those academic qualities. Look, you've done well enough for them to give you an interview offer. So that means your ATAR and your UCAT should be pretty high amongst all other students, right? So now it's your time to really showcase who you are as a person, right? So who you are, what makes you tick, and using academic examples in your interview responses might suggest that you might be a very one-dimensional person. You might have no other hobbies or passions outside of academia. And remember, for the interview, they're really looking for a well-rounded individual. They want someone who can actually build rapport with patients, who can speak with patients. So if you haven't really focused again on that area of your life, this is a very important step to kind of focus on. If you don't have that now, maybe for year 12 students after the HSC, get on that really quick. And for year 10 and year 11 students, this is the perfect time to really start exploring those extracurricular activities that you might have some interest in. Okay. All right. Now, the next pitfall, which is grandiose experiences. So grandiose experiences, what I mean by that, again, I just get a lot of students coming up to me going, oh, Dr. Jason, is this a good experience to use? Is this a good anecdote to use? Is this kind of gonna work for me? Look, at the end of the day, a student that has competed in a national competition does not mean that they will be a great doctor, okay? The qualities don't always overlap. Sometimes they do, sometimes they don't, okay? I really, as an interviewer, I don't really care about the experience as a whole on the most part, but I care about your actions and your reflections behind those experiences, okay? That reflect who you are as a person. That's what I care about because I want to find out who you are as a person. So the other pitfall that I see is that even with these kind of experiences, or even, I guess, even with students that don't have these for the students that don't have these, for the students who have experienced it, they also have trouble expressing this. And this is where Mission Med mentors can actually help you clarify and also extract what's actually needed to be said in the interview. And the next pitfall that I see is not understanding the marking criteria. Okay, so when I started teaching medical school interviews about 13 years ago, which is many, many, many years ago, the things I suggested in the past, I've actually no longer advised on my students now. The reason for that is, actually, I don't advise all of my students now because I've realized that after becoming an interviewer panelist and also understanding what goes on behind the selection of students, some of these things are basically, they're not going to help students at the end of the day. So I've actually changed a lot of what we've developed in terms of resources and compiling all the necessary information for students. That's all evolved over that many years because of the experiences that I've had. Okay, so just be careful of who you kind of speak to or who you engage in, because some of them might not have those experiences and might not understand what their interviews are actually looking for, and therefore they might not give you the best advice, not necessarily the wrong advice, but not the best advice to help you achieve or perform at your optimal level, okay? But having a marking criteria for the interview also means that with the right training, students can sharpen their ability to target specific points on that marking criteria, okay? And then that way you can increase your scores and thereby increase your chance of receiving a medical school offer. All right. Next question. I'm sorry. Next pitfall is underselling yourself. So again, I have here another really, really short video. This is by a gentleman
If you are
called
technically
Vin
brilliant, so
Yan,
you're 10 out of 10.
who's actually a magician, who's actually turned into a very extremely amazing, talented keynote speaker. And he's going to briefly share with you the importance of communication.
If you are technically brilliant, so you're 10 out of 10 technically brilliant. However, if your ability to communicate is a 3 out of 10, do you think people perceive you to be a 10 out of 10 or a 3 out of 10? We are only as good as we can communicate. As you improve your ability to communicate, you improve the impact that you have within your teams, you improve the impact that you can have in your personal lives. I've taught this to thousands of students, and I always see the same thing. Technically brilliant individuals not being recognized for how amazing they truly are. And it's simply because they keep telling others that, oh, I'll let my work speak for itself. Why not do both? Why not do both? We live in a society of this or that. It's not or, it's and. It's both. When you
All right. So
if you are
that video is a bit shorter, a bit quicker. So hopefully everyone didn't lose their attentions. So on a side note, I'm actually also a student of Vin Gan's course because I also want to improve my communication skills that when I deliver the course or when I deliver a masterclass to my students as well. So many students that I see don't know how to properly phrase, contextualize, and also subsequently sell themselves to the interviewers. Or they might come across a bit awkward, which then might sound a bit disingenuous as well, and also a bit less professional. So the common problem I see students do is they list these traits and list these qualities that they think the interviewer wants to hear. Okay, like they talk about empathy, communication, confidence, teamwork, resilience, all these things. They kind of list it to the interviewer in their interview, or even in the applications, which I've done quite a few JCU applications recently for students. Just remember, when you list these qualities, there's no way for the interviewer to know that that's the truth. Okay. What I recommend is it should be interwoven into your responses, and it should be inferred by the interviewers. This is something that, again, we teach in our course. We teach students how to do this through phrasing and wording of their experiences, and also selection of different words to use in those contexts. And this is what I think naturally allows the interviewer to understand you and understand who you are as a person. So it's no good listing it. Just make sure it has to be woven into your response. All right. And finally, we come to the last pitfall, which is lack of structure. Again, I know that some of these do overlap with each other, but again, this is a very common problem that I see. So without a clear lack of structure or train of thought, one, it makes the interviewer very hard. It makes it hard for the interviewer to follow your response. So if they can't follow your train of thought and follow your structure, they can't mark you. Okay. Imagine trying to mark someone that is a bit crazy and they talk about one thing, then they jump to another, and then they jump to another thing. The interviewer will actually start to become confused. And then they can't also latch onto new points that you talk about. Therefore, you actually do yourself a disservice, and also resulting in kind of not getting the marking criteria ticked off. Also, what happens is you end up wasting a lot of time rambling and also repeating yourself over and over again. Again, remember that there's a very clear set of marking criteria available to the interviewers. If you keep saying the same point, they're not going to be able to tick off the other points that you need to score a higher answer, to score higher in your interview. Okay. So just be mindful of that. And again, this is something that we cover. We teach in some kind of very specific ways to structure the responses that we've found very beneficial. When you become better, you can kind of throw those techniques out the door and do it yourself on the fly. But I think as a student starting out, it's very easy to get caught up and get confused. I remember when I first started out, I couldn't come up with a response on the spot, on the fly. It was really difficult for me. So I ended up really typing out and actually writing out dot points. And I recommend that for students that are having trouble. Definitely start doing that now than later. Okay. But if you want to learn how to do it properly and how to kind of really cover all those bases when you're thinking about these questions, then please do join us in our course. All right. So I'm going to pass it on to one of our superstars that has done very, very well, who's also a medical student now, Doris. And she'll talk about her experience with Mission Med and oh wait, am I talking about that later? Or was that now? That's now, right?
No, no.
Okay.
Doris will talk about her sort of like experience in medicine and before medicine and her whole journey. Yeah.
I'll shut up.
Yeah, okay. So hi everyone, I'll introduce myself again. I'm Doris. I'm a medical student at the University of New England, which is under the Joint Medical Program. And so yes, I'll talk a little bit about my journey and how I got where I am now. And I've split it up into kind of 3 sections. So before it all started and my preparation before. So I was in the midst of sitting HSC preparation during the COVID year. So everything was really strange. My exams got pushed back, UCAT got pushed back. And so my interviews were very, very close to the end of my HSC exams. And I didn't really know much about them, and I didn't know anything about the responses that the interviewers expected. Yeah, I was pretty confident with my experiences over the past few years, and I think I was mistakenly confident about sitting interviews. I had a lot of extracurriculars that I was really closely involved with and I was really passionate about. And so because of that, I felt my experiences and impact in those extracurriculars made me worthy of a position in med school. And so I was really excited to talk about it, and I was pretty confident in my ability to answer like all the questions they threw in at me. But I decided to enroll in the interview course because I wanted to give it my all and have my best chance at getting into medicine without having any regrets. So just do everything I can. And now during my experience, I sat my first mock interview with Dr. Jason before I actually had a look at any of Mission Med's resources because that was the day right after my last HSC exam. And I honestly hope he doesn't remember my interview because it was during this mock where I realized I had no idea about so many aspects of medicine interviews. I was so shaky and unsure of myself when I was responding. I had so much difficulty highlighting myself, all of my experiences within such a short time frame, and also keeping it relevant to the question. And I didn't understand the best way to answer scenario questions, and I missed important talking points that you should cover. And so from this mock, I received valuable advice and feedback on how to improve within a short time period as well. So overall, to sum it up, I thought I had the experiences and the ability to sit a successful interview, but I was just extremely unprepared for the time limit, and I didn't have enough or like any exposure to all the types of questions you can be asked and how to respond to each of them. And so after that, I watched the entire Mission Med course, which takes you through so many types of questions. It gives you scenario responses and helps you understand what the interviewer is actually looking for, which was pretty life-changing for me, I think. I reflected on my own experiences and I planned out talking points for different potential questions. I practiced out loud using the question bank and with a small group of friends. And then I sat my second mock interview actually with Mukund to much greater success, I think. And so I think this is all pretty overwhelming. So some tangible advice I would say would be to, one, reflect on your experiences and anecdotes, but focus on what you've learned from them, what skills you've gained, how you've developed as a person as a result of those experiences. Don't downplay your successes because you're there to show yourself off to the interviewer. Practice out loud with friends regularly. I think the more embarrassed and self-conscious you are in the moment, the more it'll help you get over that learning curve or that barrier before your actual interview. And try to enjoy the interview because I think this will really help you showcase your passion. And it's a lot easier said than done, but I think this will really help you set you apart from other candidates. And it shows your motivation simply through your manner and the way you deliver your answers. Okay, so after the course, I obviously had increased confidence. I had a lot better structured responses that included all the keywords, concepts, and nuances that interviewers are really looking for. And at the end of all of that, I got an offer at the Joint Medical Program, which is entirely based on interview. So now I'm a third year medical student at the Joint Medical Program. I'm just finishing off my last placement of the year, which was general surgery. I'm a UCAT tutor and interview tutor at Mission Med. And along the way, I've also been involved in UCAT content creation, strategy consultation, and article writing. And as an interview tutor, I've actually met at least one student each year who got into med at my university after sitting a JMP mock with me, which has been super cool. And then outside from receiving a med offer, interview prep has helped me become a better speaker, presenter, and communicator in my everyday life. So some highlights of med school and hopefully what you have to look forward to. I moved out to live in college at 17, which was terrifying at first, but I think I got so much personal growth from it. I did lots of venipunctures and cannulas. So a venipuncture is just like taking blood. And a cannula is when they insert like a little plastic straw into your arm and they give fluids and antibiotics through that. So I thought it was super cool I got to do that. I definitely failed a couple of times as well. I had some heartwarming and memorable patient interactions where I felt even as a student, I was really making a difference to their experience in hospital or at the clinic. I first assisted on an orthopedic surgery, which basically means I was the primary and only assistant after the surgeon himself, which was super cool. I organized and taught suturing workshops as part of my surgical society, and then applied these skills later to suture on real patients during placement. Sutures are basically stitches, so it's like that little pork trotter on the screen. And despite what people say, medicine is not all about academics and you can have a life outside of studying. I have a passion for design and art, and so I've also been able to design uni merch for my medical society and also the monthly magazine newsletter. And then lastly, I've met lovely, lovely people in uni who have similar interests and passions as me, and I've met so many kind, inspiring, helpful doctors during my placements. So overall, I'd say med school isn't easy, but I'm so, so glad and I'm so grateful that I get to study what I do. I think my coursework is so interesting and intellectually challenging, and I'm really inspired and motivated by what I see, do, and everyone on placement. And then to sum it up more, Dr. Jason, Matt, and Mukund are some of the most hardworking and ambitious and inspiring people I've ever met. And I'm not just saying that. I think they've definitely put their all into this course. So I definitely would not be where I am without Mission Med. So that's my experience in this course and also what I've been up to after. Thanks, everyone.
Thank you so much, Doris. And that was amazing to hear about what sort of amazing things you got up to after at med school. That's so cool. Okay, great. Awesome. So the next thing I think, Jason, just so you can briefly kind of talk about is a bit about our actual course. And then stick around because we'll be giving out a promo code for people who attended tonight as a thank you for coming along. And then we'll also cover what actionables you should do from here on out, as well as when the interviews for different universities will be. And then finally, we'll go through the Q&A and make sure we answer everyone's questions that they have today as well. So plenty more to come, but I'll hand it over to Jason.
Sorry, I was on mute. Thanks, Matt. And thank you, Doris, so much. I almost cried. Okay, thanks everyone for sticking around. I know that we're getting towards the end of the night, so everyone must be getting tired. So I'll quickly just sum up what Mission Med offers, and hopefully you'll join us in our course. But look, there's no pressure. We still want to be able to help students out, no matter kind of where you are in your journey. And if you choose to go with someone else, that's totally fine. But if you choose to trust us, then we'll, endeavor to work our hardest to get you into your dream career. So at Mission Med, we do pride ourselves on having a very close relationship with all our students, as you can tell with Doris now being part of our mentors. For every student, their journey into medicine is personal, and we take it very personally as well. So many of our past students get into the same medical schools as their mentors and become close friends, as Doris did allude to. And subsequently, they also join on as Mission Med mentors in the future, helping other medical students other aspiring medical students achieve their goals. So our track record has been amazing so far. We've had about 8 out of 10 students that come through our medical interview program successfully obtain or achieve their dream of becoming a doctor, essentially, because they have been offered an interview. They have been offered a medical school place. So to break down what our interview course offers, so the first part of our interview course is our online video course, which are compiled from over 13 years of experience and also from Matt and Mukund's experience over these last 5 years as well. So our online course consists of over 50 videos and articles that will teach students the foundations of the interview. So it'll tell you how to structure your responses, teach you on how to reflect on those experiences, how to phrase those experiences. We also talk about current pertinent health issues and Indigenous health issues as well. There's also videos that will dissect good and bad responses, so you can actually understand what makes a good response and what makes a bad response, thereby allowing you to also self-reflect on your own responses. Hopefully when you record yourself and listen back, you can start to kind of pinpoint and actually pick out those areas where you can make improvements and those areas where you might have to leave out. The second component of our course is a guidebook. So this is a extremely popular comprehensive student guide that's about 132 pages long that breaks down previously recorded interview questions from the last 20 years with some model answers as well. The next component that we're very proud of to have is our question bank, which We always update year to year with new questions that have come from the previous cycle as well. So this is questions from various universities across Australia. You're able to filter these questions based on university or question type so that you can practice and focus on those questions that you actually want to, focus on those questions where you are applying to those universities where, those SSI universities or MMI universities, you can select and filter those out so that you can just practice on the universities that you've been given interviews for. There's also We've also worked very hard on providing exemplar responses to select questions to give students, again, an example of what a high scoring response will look like. Because I know that when I was going through my journey getting to medicine myself, and also from feedback from previous students, a lot of students didn't understand what a good response might look like. So having a good response to kind of guide your answer or give you kind of boundaries, I guess, to kind of work on. It just allows you to come up with your own response that might be a bit better. The next component is our masterclass. Okay, so once students have been taught some basics or have done the basics from the online video course, we'll kind of dive into more difficult questions with specific feedback from me personally, so that all students can understand, again, what makes a good response, what key factors do we need to be considering, how do we use the lessons that we've learned from the video course, and how do we apply it to those questions as well. In addition to that, we also have a student community group on Discord where students can ask questions directly to all the mentors of the course, including myself, and we'll be able to help, again, provide you with guidance. I try not to give solutions because I want students to come up with their own solutions ideally, but I will provide generally guidance on whether their response is good, what needs to be improved on the responses, and things like that. And that way you get that continued mentorship from now all the way to interview, making sure that you can practice all the way throughout. And finally, our mock interviews. So this is an extremely important component of our interview course, because we did find that students who didn't complete mock interviews also didn't tend to do too well because they weren't getting that personalized feedback that we know is so important, as through that video that I showed you earlier. Getting that feedback is going to really, really improve your responses and your answers. Okay, so this is the same as taking a mock exam, right? So before your HSC, you do your trials and you do a lot of past papers. This is a similar thing for interviews. Okay, so that's why it's so important to do mock interviews. And as Doris mentioned, unless you do it, you actually don't know where you stand. You don't know how well you're actually performing if you don't do a mock interview. So following the mock interview, student will receive one-to-one feedback from their mentor and also a report, a diagnostic report that will detail feedback, areas of improvement, areas where they're doing well in, so that students know exactly what to do in order to be better next time. Okay. Also, the mock interviews have been designed so that they actually reflect the marking criteria provided by universities, so that you can actually look at the marking criteria and then actually figure out, oh, I didn't say this, or I didn't say this, and this is where I, scored a bit lower because I didn't say these things. So again, we provide all that detail in the mock, in the diagnostic report. So you'll get all that after you completed your mock interviews. So I would even highly recommend considering doing a mock interview early in your practice to, again, see where you stand, see how much effort you actually need to put in to really improve. Oh, sorry. How much effort you need to put in to basically receive a medical school offer. So if you've done really well in your mock interview, in your first mock interview, and you're just naturally very talented, great. You can probably focus on the HSC a bit more. But if you're someone who don't have those kind of skill sets or don't understand exactly how to do it, then it almost serves as a wake-up call to allow you to, to tell you, oh, look, I really need to focus on, improving myself, improving my interview performance so that I actually get a good chance at getting into medicine. Because remember, as Mukund said earlier, the interview counts for most universities, okay? So the next slide just shows our full package, okay? We've combined everything together because we want our students to succeed. And we realize that for students to succeed, they really have to go through that process. Because again, like I mentioned earlier, without getting that personalized feedback, without getting that mentorship, students just tend not to do as well, okay? So you start off with a self-paced component of the course, and then you eventually work your way down to the more personal aspects of the course where you have one-to-ones with our mentors. Okay. I also like to give you guys a mission med guarantee. So we offer this to students because, again, we're as committed to getting you into medicine as you probably are, because you've spent the last 1.5 hours sitting here listening to the talk and presentation. So we know that there's always going to be some degree of uncertainty with some of you not sure whether you'll get an interview offer or not. I totally get that, because sometimes the scores do change year to year. And also, if you kind of score on that borderline mark, it is very hard to know whether you'll get an interview offer or not. But at the end of the day, we're committed to helping you achieve your dream, okay, which is to become a doctor. So if you purchase our course, we'll guarantee that so if you purchase our course and if you complete our online course, we will, but if you don't receive an interview offer into medical school or offer into medical school afterwards, we will extend your access to our course for the following year. So you'll have access to all our online resources, all our videos, which we will update, question bank, again, which we update every year. You'll have access to that for another year, which will give you another shot at getting into medicine. And in fact, we've actually had a few students who unfortunately didn't make it the first time, and they've succeeded the second time. And that does happen to some students, but like I said, we're always here to support you no matter what. All right, so now we're almost finished, so please bear with me. Next part is just a promotional discount that I like to offer everyone, because I just want to thank everyone that has attended today and for joining us this evening. So we're offering you guys a 5% discount on our package for the next 48 hours. So make sure that if you are interested, if you do trust us to get you into medicine, then please make use of this offer. So feel free to take a screenshot of the slide so you don't lose it for later. Or you can enroll now by scanning the code, or visiting our website at www.missionmed.com.au. Okay. All right, now I'll hand it back to Matthew, who will just do a quick brief of the actionables that you should be doing right now.
Okay.
Yeah.
Thank you so much, Jason. And for everyone, this promo code, just make sure that you take a photo of it, because we've had situations in the past where lots of people email afterwards asking what the code is and stuff like that. So just make sure you have a record of it somewhere and know what the site is, so that if this comes up again and you're interested in it, you know how to enroll. Okay, cool. So I think that's enough time on this slide. So the next thing I want to chat about is where to from here for someone who is interested in medicine and wants to do the medical interviews. Now, what you can see down here at the bottom is a timeline of when the major sort of testing periods finish and when the actual interviews for various universities occur. So we've researched and put together, and what I want you to sort of realize is that all of these interviews clump around the end of November and the earlier half of December. So you can see UNSW, Adelaide, JCU, Monash, WSU, UWA, JMP, UCID. They're all sort of clumped around that time period. But I also want to draw your attention to the fact that that time from after you finish HSC and or IB, whatever you do, or after whatever major exams you have, till when the first interviews start is really only half a month. So 2 weeks or 3 weeks of time. So everything that we've talked about in the past, 1.5 hours, if you don't do something now to get the ball rolling, you will have only 2.5 weeks after you finish your major exams to prepare for the interview. And quite frankly, that's just not enough, right? So whatever you choose to do from here on out, there are 3 things that I want you to start doing now. And if there are parents in this meeting as well, I want you to encourage your children to do this as well, is first of all, create a Word document with every relevant personal experience that you've had in the past 2 or 3 years. Relevant personal experiences do not necessarily have to be just, I was a prefect, I was a school captain, I did chess competitively, I did sport competitively. These are experiences that are good, but some other experiences that are useful are things like, for example, I had to stand up for a friend one time because someone else was saying something that just wasn't appropriate, and I stood out for that. Like, this is not something that is what we would call a grandiose experience. It's not like, being a prefect or whatever, but it's something that you can speak about during the interview. And you kind of want to just rewind through the last 2 or 3 years of your life and think about sort of situations that have stuck out to you and have changed the way you perceive or think about your life in general. Because these are going to be very difficult to sort of cram, if you will. You can't think of them immediately on the spot. They sort of have to come over a period of time. So build up that database of experiences, build up that Word document. That's the first thing you can do from here on out. The second thing you should do is consider how you're going to answer the hardest question in every interview, which is always why medicine and not another career? Because this variation of question will come up in many, many different forms across MMIs and panels, right? And the most generic answers are always things like, I want to help people. I want to, make the world a better place. I want to, there are many ways to help people. You could be a, nurse. You could be a dentist. You could be you could be just about anyone, and you could help someone or some person, right? So the question is, why do you want to do medicine specifically and not another career? This is a hard question to answer. And this is something that you need to think about actively rather than leaving it to the last minute right before your interview to think about what you're going to say. That's the second thing. Third thing is, I want everyone to spend at least 10 minutes to 15 minutes every night thinking about the interview. And when I say thinking about it, I don't mean you have to sit at your desk, pull out a textbook and start practicing the interview like you would for maths or English or do a past paper or whatever. That's not the point, right? Or study for your uni subject. The point is that you spend at least 10 to 15 minutes thinking about it. Let it occupy your mind space, whether you're brushing your teeth on your way to work, on your way to school, taking care of a baby, or whatever you might be doing, right? Just spend 10 to 15 minutes thinking about what experiences could I talk about in a question like this or a question like that. And so for Mission Med students, for instance, you could start watching 1 5-minute video from our course every night, or practicing a couple of questions over the dinner table from our question bank with your parents and seeing what they think about your response, right? These are not big time commitments. This is 5 minutes or 10 minutes out of every single day that builds up equity over time, right? So it's definitely something that you can fit around your study. So try and get that started. Try and get that ball rolling. Okay, so overall, main point is, these are the actionables you can get started on right now. So please, from our experience, we see students who get started on these things early do much better. So please take this advice. If there's one thing you get out of this, please do this as soon as possible. Okay, great. So I'm going to pass off to Mukund, who's just going to briefly chat about strategy consultations for anyone who might be interested. And then after that, we'll pop over to the Q&A real quick.
Awesome. Thank you, Matt. So thanks for bearing with us this evening. I know it's been an hour and a half, so we won't take too much of your time. So essentially, even if I look back at the chat tonight, we've had quite a few questions so far asking things like, I got a UCAT of this much, or I have a expected ATAR of this much. What are my chances of getting an interview offer? What are my chances of getting a med school offer? I'm a year 10, what should I be doing? I'm a year 11, what should I be doing? I'm a year 12, what should I be doing? Ultimately, every individual application or applicant is unique. They have unique circumstances, and the advice that you receive is ultimately going to have to be very, very personal. And so what we've essentially done is we've created these strategy consultations where we basically start by getting you to fill in a form with your information so that our very experienced admissions consultants can then have a look over your essentially what is your application, what your scores are, and develop a very specific tailored action plan for you to help you essentially get the ball rolling. And so that basically applies no matter where in the journey you are. If you're in year 10 and 11 looking to essentially get a lay of the land, trying to understand what should I be doing now over the next couple of years to be the best or the strongest applicant possible by the end of year 12, or even if you're a year 12 now who's done your UCAT and is preparing for your HSCs and you want to know what options are available for you, this is a very, very good opportunity to take advantage of, where we will basically go over your application. And so just a disclaimer, this is a paid service as well, but essentially what you get out of it is a very personal recommendation. So you'll basically get a booklet outlining everything that you need to do from here on out to give yourself the strongest possible chance of getting into medical school. And so if you're very interested in that, please also just scan that QR code and sign up for one of our sessions. And so that'll basically help, especially for some of the people who've attended today who are interested to know, like, oh, what are my chances of getting in based on XYZ score, or I'm a year 10 or 11, what do I do? This is essentially like perfect for you to kind of get the ball rolling and answering some of those questions, and you won't get a generic response like we'd have to unfortunately give you over this webinar and the Q&A just because of time.
Okay, perfect. Thank you so much, Mukund, and scan that QR code if you're interested. We're now going to hop over to the Q&A. I see we've got 22 questions here, and they're sort of sorted by likes or how many upvotes there are. So if you want a question answered in particular, please upvote it. But again, I'd like to encourage everyone, if you do have questions, look at the bottom of your page and you should see a Q&A button. You'll be able to press it and ask questions. So the first question is something that's a little bit less related to the interviews, but it says, when do you recommend to start preparing for the UCAT? I'll just answer this one quickly. So in general, we say that the UCAT prep should be 1 year in advance. So if you're sitting the UCAT in July or August, you should be preparing for your UCAT typically around August, starting from August, September in the previous year. The UCAT gets more competitive every single year. The 99th percentile cutoff increases every year. So generally speaking, it's good to start early. So I'll just say that that's answered. The next one I think was, I got a reasonably good score. I need to focus on my HSC as I feel that there are a few topics I need to brush and do past papers. I feel I will not have time to focus on interviews now. Do you think it'll be a good idea to start from November 8th? Thank you. And it says here afterwards, I got my answer, thanks. Just to follow up, do you think if I take a gap from October 1 to November 7th, will that be okay? I can focus on interviews the whole of September. Look, I think in general, based off of what we talked about today, what we're suggesting is that you don't necessarily have to dedicate full days to interview practice when you're trying to tackle your main exams, right? What we're just suggesting is that you invest a small amount of time every single day, can be anywhere between 15 to 30 minutes, or it can be 5 to 10. The thing is, you actually start doing it, because when you don't think about it at all and you just cordon it off until after your major exams or right before the interviews, that's when it gets tricky. So just start doing it gradually.
And I just also mentioned that science says that distributed practice is, you could end up doing better if you do distributed practice. What I mean by that is you distribute the amount of the time over a long period of time, as opposed to cramming it into one or two sessions or like few sessions. And you have scientific research to back that up, to say that's actually the best, like one of the best ways that you can study. So definitely as Matt recommended, just start practicing early, even if it's 5-10 minutes. Again, that's really gonna make a huge difference when you actually come up to your interview.
Yeah, perfect. Okay, I'm going to say we've answered that live. Next one was, does the answer need to have medicine context? I think this was in reference to an earlier question about like the important issue to solve. So I think we did answer that at that point. So I'm going to skip that one. For the MMI question where Sam admitted he had a drinking problem, would it be appropriate to seek advice from a more senior physician? Mukund, what do you think? Do you think where Sam admitted he had a drinking problem, would it be appropriate to seek advice from a more senior physician?
Look, I think you'd have to weigh things up, because obviously in asking a more senior physician what to do, you have to potentially divulge some information about the scenario that you might not want to or necessarily should immediately, especially if it's very, very new and fresh. And secondly, but in general, I think asking for help from a trusted senior who you is a mentor to you is almost never gonna be a bad thing. And sometimes you can get a lot of advice from them. So I think again, it's nuanced. There's no black and there's no like necessarily right and wrong. It's just how you discuss the benefits of doing that versus the cons of doing that, if that's how you choose to answer it in the interview.
Fantastic. Okay, cool. So I'll say that's answered. The next most upvoted one was, I noticed some of these ethical situations are quite similar to the questions we see in the situational judgment section for UCAT. Would it be helpful to go through situational judgment questions for practice too?
Yeah, so with that one, I think that's very interesting. I think you're right in saying that some of the ethical situations are relevant. I think the most important thing, though, is to actually practice answering these questions out loud with a structure. Because obviously with the UCAT questions themselves, it's literally just getting you to answer most appropriate, least appropriate sort of thing. This is like the interview is not just about recognizing that, it's about actually being able to articulate a nuanced opinion. And so if you use those questions kind of just as like, different situations to think about and what you might do and actually practice out loud, then by all means, that's a very transferable skill that you can do. So I think, there's nothing wrong with that.
Cool. So the next one was, is there a difference between the medical interviews for high school leavers versus graduate entry? Jason, I think this one might be good for you to address.
Yeah, so I don't think there's a big difference in terms of what they're assessing you on, but I can tell you just from my experience being an interview panelist that the graduate interviews are generally much harder because a lot of students have life experiences. So I've seen PhD candidates, I've seen students who've had 5 or 10 years worth of working experience. I've seen lawyers, I've seen a whole bunch of people with just just a whole variety of backgrounds. So these people, given that they have these life experiences, are probably better at articulating and also answering those responses because they've just built those skills up over such a long period of time. So definitely the competition's a lot harder for graduate entry from an interview perspective. So as a high school leaver, I do find that, a lot of high school leavers are still a bit naive, a bit kind of green to kind of the real world. So generally speaking, the requirements for the interviews per se are probably going to be a bit less strict.
Yeah, definitely. In terms of the interview formats, I think the graduate interviews are pretty much all MMI interviews, whereas obviously with the undergraduate or high school leavers interviews, some of them are going to be panel versus MMI. If you are a graduate entry student, but you're applying for a program that accepts high school leavers, then you will have the same interview format as everyone else. It's only if you sit an interview where the medical school is only postgraduate students, then you might have a different interview format, and it's pretty much always MMI. So it's the multi-station format that we talked about earlier. Cool. Okay, fantastic. How many questions are there typically per station? That's a good question. So Mukund, do you want to take that one, or Jason? Which one? Whichever. Okay.
It varies between different universities. That's why it's important to practice for each university that you're applying to, or each university you expect to get an interview for, because you do have to change the way you approach different universities. So we know that JMP, UNSW, even JCU to an extent, it's really time pressure. You don't get a lot of time to talk, whereas other universities want you to talk a lot. So like WSU or like UQ, they do expect you to really be thinking outside the box in those circumstances. Whereas the first three universities I talked about, you really don't have a lot of time. You have, 1 minute or 1.5 minutes to basically answer their question, and you really have to kind of answer it quickly. Otherwise, you lose the opportunity and have to move on. So, and then you have the other side of the coin with the other universities, where if you don't answer enough or don't give enough of a response, they can't tick off those boxes on the marking criteria. So that's why it's so important to know which university, like know the style of each university and practice for that style of university. And each university will have their own kind of, they might have some slight variations to the marking criteria as well and what they look out for. So that's why it's really important to practice for individual universities as well.
Definitely. Yeah. Absolutely, 100%. And typically, per station, depending on this university, you're going to see between 3 to 4. And like Jason said, some universities are going to have more or less time available, but 3 to 4 is generally how many you see per station. I think we saw a question earlier from Yun Young Kim as well about how early do you recommend to start preparing for the interview? And just to say that out loud, regardless of how you choose to practice, we would strongly recommend starting basically now. You don't have to dedicate every single full day to it, but just start now with a small amount of time every day. Yeah. Okay, cool. So that's that particular question. Aless says, I have a number of volunteering experiences over several years. This includes volunteering at a hospital. How can I work in the experiences that I've obtained? This one's a good one for Jason, because obviously you've heard a lot of experiences from people talking about their volunteering. What is the best one that you've heard, or some of the good ones that you've heard of how people do it?
I mean, it's not so much you have to include it, because some questions you don't have to include anything really at the end of the day. You don't have to relate it back to medicine at the end of the day either. So I do get these questions a lot. Do I have to relate it back to medicine? Do I have to, do I have to give an anecdote for every single question? You don't. But if your anecdote fits the question, or if they specifically ask for it, then yes, you should. But unless they ask for it, or if it fits, or if it fits the question, I probably wouldn't bring it up, because again, one, you're not really hitting the marking criteria, because they might be assessing something totally different, and you've now spent 1 minute talking about your experience, which doesn't even answer the question. So again, you have to be quite careful when you introduce your anecdotes. And again, you kind of understand that as you practice. You'll see the type of questions that will require it, and you'll see the types of questions that don't require it. And this will come with a bit of experience as well. And again, this is something that someone who has experience, like a mentor, will be able to give you that feedback and give you that advice to say, look, you should have included it in this situation. You shouldn't have included it in that situation. It's a tricky one to answer, because again, there's no right or wrong answer.
Okay, fantastic. Yun Young Kim answers a very sort of similar question. Is voluntary experience helpful for interviews? So I guess maybe I can answer this one, because I can speak about how it was helpful for me during interviews. So like, I think it's less so about what the voluntary experience is itself, as we've spoken about before, as Jason and Mukund talked about, but more so about what you learnt from it and how you choose to paint it for a particular question. So as an example, one question that UNSW likes to ask is, how have you advocated for someone in the past 2 years, right? Or how have you advocated for someone close to you? And in that question, that's a very difficult question to answer if you don't have, real experiences to draw from. If you volunteered, say, for example, at a homeless shelter, or you volunteered at a, like a community kitchen, then there will be plenty of interactions throughout that volunteering that you remember or draw upon. And so that can be helpful. Your experience can be helpful in drawing upon sort of specific situations that occurred during your volunteering that help you answer some of the trickier questions, because you kind of, mold it into whatever the interview question is. So that's kind of where I would say it's helpful. However, having said that, obviously you can see that with a question like, how have you advocated for someone? Other experiences can also help you answer that. For example, if you just stood up for a friend in front of a bully at a school, right? That's advocating. Or for instance, you advocated on behalf of an organization. For example, like Go Green at school as an environmental organization, right? So there's different kinds of ways you can spin it. Volunteer experiences, as are any other experience, good for having interactions that you can draw upon. That's probably how I'd summarize it. Cool. Next one. Are the interview questions and approaches to the questions transferable to dentistry interviews? For example, UCID or JCU, or will the dentistry interviews take on a different angle? What do we think?
They usually, look, I'll be honest, from experience, like Adelaide used to have the same interview for dentistry and medicine. So the skills that they're assessing you for as a healthcare professional is translatable to any healthcare professional at the end of the day. Okay, even for like oral health or Bachelor of Oral Health. Yes, dentists will need other skill sets like dexterity and kind of hand and eye coordination kind of skill sets, but usually these can be developed. But for the purposes of the interview, you pretty much will be assessed on the same set of criteria, on the same set of attributes, because at the end of the day, governing bodies are very kind of similar across the board as well. So APRA, again, governs all healthcare professionals, which also includes dentists. So at the end of the day, I don't think there's much difference in terms of the assessment. But in some situations, like for Western Australia, I believe that the interview style can be a little bit different. But that's the only thing. I think at the end of the day, the assessment and the criteria are pretty much the same across the board.
Agreed. Yeah. I sat some dentistry interviews when I went through my admissions process, and the questions they were asking me, pretty much exactly the same, like in terms of ethical scenarios and stuff. Sometimes I get a couple, dentistry specific ones sprinkled in there. Like sometimes they might have asked something like, they asked me specifically, how would you innovate to improve upon dentistry practice going on from like, past to now? And I just basically spoke about like, better patient education, and often people are scared to go to the dentist. It's sort of the same thing with medicine, but you sort of just put a dentistry spin on it. So it's basically the same. Okay. Okay, we've already done these questions. In the MMI format, will extracurriculars, personal experiences be a point of discussion as well? Mukund, do you want to address this one? Will extracurriculars or personal experiences be a point of discussion in MMI formats?
Yeah, I mean, they'll always come up. I think the tendency is for it to be a bit more inadvertent in terms of the way they ask you about your personal experiences in an MMI, because they try to embed it as like maybe a sub question in a scenario. Like they might, have a scenario about like dishonesty, where it's like, a scenario of someone cheating on an exam or something, and then they might like ask you if you've, experienced, like if you've witnessed that before, and how do you deal with it, or how would you deal with it if that's what you saw. So they can weasel it in whatever, however they want. Sometimes they will just straight up have an entire sectional room just on personal questions. It's really varied, but yes, they do assess personal questions in both interviews. So it's important to prepare for that regardless.
Cool, fantastic. Next one was around, and this might have to be our last one actually, because it's 5 minutes left and we want to make sure that we wrap up okay. So around what UCAT this year would be accepted at UNSW. So we've actually put together a document that kind of shows everything about the admission criteria for different universities. UNSW reports a minimum UCAT, and then there is a kind of like average UCAT that you actually need realistically to get an offer, and that's just based off of data that people have collected around who got offers in the past interview year. And just off the top of my head, typically the UCAT that you need to realistically get an offer is 96 percentile or above. Having said that, though, that is not an absolute, because there are many situations where people have special consideration, or their ATAR might be very high, or they might do exceptionally well in their interviews. So there's many, many different factors. What we just see is that it seems like 96 is sort of generally where above that, you've got a good chance, and below that, it's a little bit more difficult.
Yeah, and UNSW historically has been a university where it's really an interview kind of makes or breaks your application. Like there have been people that have had like, well below average UCAT and ATARs who like, really clutched up because of interviews, and they do really, really well and make it through. And conversely, the opposite happens too, where, you have your perfect ATAR gunners who don't get in because of a poor interview. So the interview is like very, very important for UNSW.
Okay, great, perfect. So I might just find that document that we made real quick, or actually, I think if you actually sign up to our newsletter, you can also get it. But if I can find the document on my computer, I might be able to send it in the chat as well.
I can just send it as a newsletter, Matt. So that way it's just easy, because a few people have had enough already. So I think we can just send it out.
Okay, cool. All right. So we have like, as in, if you send, if you can put in your email for a newsletter, we just send out useful information about the admissions process. And the first email you'll get is the table with all the admission requirements. I can't find it at the moment on my computer for some reason. It's probably with our technical staff at the moment. But if you do that, then you should be able to find it. So just really quickly, thank you everyone for sticking around and asking some really insightful questions. Just as a reminder, the enrollment for the actual course can be found here. You can scan the code, or you can go to missionmed.com.au, and the code, just make a note of that so you don't forget it. Otherwise, thank you very much. You'll get a survey at the end of this webinar. It only takes 2 seconds to fill in, but it really helps us understand how well we did and where we can improve on. Thank you so much, everyone, and have a wonderful night.
Thank you.
We
everyone.
hope to see you all, throughout the year as part of our interview course. So thank you so much.
And best of luck with your interviews.
Have a wonderful night, everyone. All right, fantastic. Okay, well done, team. Good stuff.
I think there's still people here, right?
Yeah.
You can turn off the recording.
Shall I? Yeah, I will stop the recording now.